Hi, my name is Faris Mujezinovic. I'm professor and specialist in obstetrics and gynecology. In previous videos, I talked about why ROTEM diagnostic test is so important in clinical obstetrical practice and then explain how the test works. In this video, I will focus on the graphical record of ROTEM investigation and then analyze its elements. Let's look on the diagram on which we write the values of ROTEM investigation. The x-axis follows the changes over time, and on y-axis we have null position and units in millimeters that describe formation and hardening of the clot in the blood sample. The resulting clot in the sample blood was a tap away from the null position. At the end of the investigation, the graphical record has a typical and characteristic curve, which reminds of silhouette of the swordfish, on which we can recognize the elements such as sword, head, torso, and tail. At the beginning of the investigation, when the blood sample begins to rotate, the tab stays in place, which is seen at the flat line at the beginning of the curve. Soon after, a clot begins to form and the record moves further and further away from the null position as the investigation goes on. It reaches maximum at one time and the clot width doesn't increase any longer. At a certain time, the record goes back to the null position, which indicates that the clot loses its hardness and begins to disintegrate. In this typical graphical representation of ROTEM investigation, we can identify some parameters that can be also numerically estimated, so we are no longer dependent just on the subject evaluation of the appearance of the curve. For better memorization and understanding, we can say that we have two parameters for the hardness of the clot and two parameters for the lysis of the clot. There is just one parameter for initial stage when the clot prepares to form. These are CT, clotting time. This is the latent time from the addition of the reagent to the blood to the onset of the clot. CFT, clot formation time, and alpha angle. It is the time defined by the tangent from the end of the CT and 0 millimeters to a clot hardness of 20 millimeters. MCF, maximum clot firmness. The maximum clot firmness defines the maximum clot strength and represents the maximum vertical amplitude of the record. LI30, lysis index after 30 minutes, and ML, maximum lysis, are opposite parameters. The LE30 value is the percentage of the preserved clot stability relative to the MCF value 30 minutes after CT. Similar values can be calculated at other times, for example 45 or 60 minutes. The ML value describes the percentage loss of clot stability relative to the MCF in the percentages at any time point or when the test is discontinued. Parameters that predict low MCF values early in the process are A5, A10, A15, and A20 values. These are vertical amplitudes that describe the hardness of the clot on 5, 10, 15, or 20 minutes, beginning from the CFT, and can predict the expected MCF value already in the early stages. This allows for faster therapeutic action. Now that we know the normal physiological form of the ROTEM record, we will continue to look at what the records look like in the various assays on which the ROTEM investigation yields results.